Welcome to Wellness Matters with Dr. Eric Nepute.
Well, good afternoon, everyone. Welcome to Wellness Matters. I'm your host, Dr. Eric Nepute, and with us in studio, as always, we have our right-hand man, jack of all trades, master of none, Ryan.
Hello.
And our rock star producer, Kane. Say hello, guys.
Hello.
All right, for those of you that have not heard this program before, let me just kind of set it up because I want to get right into the meat and potatoes. You know, by trade, I am a doctor of chiropractic, and I practice functional neurology, nutrition. You know, I run an integrated wellness center, which basically means it's a one-stop shop for everything. We treat everything except for if you need a surgery, if your bones are broken, we can help you decide what to do, but we don't do that in the office. I mean, it's almost like a super Walmart for healthcare. And this radio program really and truly came out of complete frustration and disgust of how sick our society is. You know, I can't tell you how many times a day, literally hundreds and thousands of times a week and a month, people come in and have sick problems. And quite frankly, they're simple solutions, but they don't know what to do. You know, I can't tell you the countless number of people that have spent hundreds of thousands of dollars traveling the globe, and they're completely sick, they're disgusted, they're literally financially broke and busted, and they don't know where to turn. And out of complete frustration, they find a doctor like myself that runs a wellness center, and they come here, and for a couple dollars or a couple $100s, they find the cause of their problem.
Right.
You see, it's crazy. You know, so the whole purpose of this program is to help us get the mission and the word out that we want to bring health and care back into healthcare. We've got to stop bleeding. I mean, we are just completely dying and sick as a nation. And so what we're going to do is this. We're going to give you all the options when it comes to health and wellness. And we're going to teach you tried and true tested principles that wellness doctors like myself not only prescribe for our patients, but share it with our families. And how many of y'all know if we're going to tell it to our kids and our families, it's probably something you want to listen to. And I don't know if many of you have heard our show before, but we give tons of info. We answer calls online. We take calls on our Facebook page. We answer emails. And quite honestly, we're here to help you. So that's really my rant for the day. If that wasn't ranting enough, we actually Ryan and I had a car ride to the studio this morning, where we were talking a little bit about our purpose. And man, I said some things in the car that we just can't even say on the radio, which is unfortunate.
I'm not surprised by that.
Well, you know, because here's the deal, is we got to get the truth out to people, because the truth will set you free. You know, so many people are sick and tired and are hurting and disgusted and busted, and they don't know where to turn, and they've given up hope. And basically, all they need to do is elevate their life. You know, it's like we say on every show, Ryan, is that people are just being lied to on a daily basis. You know what I mean?
Yeah. Well, you know, you and I were reading that article on the way over here about now that the pharmaceutical companies are now telling women, healthy women who are supposedly high risk for things like breast cancer, that they need to just proactively get on these cancer medications just proactively, even though they don't have it. So I guess they're tapping into a new market. I guess there wasn't enough sick people to give these to.
You know, that is disgusting, by the way. And I don't know if let me just repeat what he said. You know, I don't know if you heard this either, Kane, but he said that basically there's new research out that says, or not even research, there's actually articles out that say now the cancer markets are saying that we need to do proactive pharmacology, so proactive drugs to reduce the risk of cancer. And the reality is, didn't it say in the study that there's no proof that actually works?
There's no proof. In fact, it was showing how I think one out of so many, I think like 7 or something like that, ended up developing blood clots, and then more ended up developing uterine cancer. So here they are trying to it's crazy.
Yeah. It's really disgusting is what it is. And the reality of it is that, you know, I don't want anyone to think in here that we're against medicine or we're against drugs or because there's a place for all that stuff, you know. But just like we talked on the last workshop or the last class when we had Dr. Troy Dukowitz on the program, which I thought was a phenomenal.
Absolutely.
Awesome.
And we're going to have him back on again in a couple months for sure. So Dr. Troy, if you're listening, brother, shout out to you. But, you know, we were talking about how some of the research shows that over 160,000 Americans die every year from just taking the drugs that are prescribed to them.
Yeah.
You know, and it's just crazy. And the reality of it is this, and this is something I want to get into because I want to get our speaker, our guest for today on the program. But one of the things I want y'all to know is this, is that we are absolutely being lied to about our sicknesses. So I don't care what your condition is. One of the things that I want to teach you today that is super important that you understand, and you ask your doctor this on your next visit, it's a real simple question. And the question is why?
Yeah.
If the doctor says, hey, Mary Jane, you need to take this pill for your blood pressure and it's going to help your blood pressure, you should ask, well, why do I have blood pressure? And why do I take this medication? And what does it do to me?
Yeah, I don't feel like they ever really explain why you even have high blood. They may say like, oh, well, you have elevated cholesterol or something that probably has to do with your blood pressure. But you're saying it has nothing to do with that.
Well, I'm not just saying it. The physiology of the human body is saying it. It's not me. It's thousands and thousands and thousands of articles of research that shows that there's one cause of all death, disease, and sickness. There's one cause. And let me teach you guys this because this is a huge thing right here. There's one cause of this. It's your body's inability to adapt to stress. Now, listen. When I say the word stress, what do you guys think about? I mean, Ryan, if I say stress,
I just think of like mental stress.
Okay, Kane.
What's like a tie game in football?
Yeah, amen, brother.
At the last minute.
So we always think about emotional stresses, right? Well, there's three kinds of stress. There's emotional stress, so like my wife, my kids, my life, my spouse, my husband, my job, my money. This is emotional stress. And then there's also physical stress, like being overweight, being in a car accident. How many of you have kids? Have you ever seen them? How many times do they fall when they learn to walk? There's physical stresses to the body. And then we also have chemical stresses. Chemical stresses of, having a poor diet, eating too much of toxins that are in the environment, in the air, and in the water we drink, and the foods and the drugs. The thing is that all those stresses are considered the same in the body, and our body adapts to it the same. So finally, what happens is the body says, I can't handle this anymore, and then it develops a disease.
Or a symptom.
Or a symptom.
Okay.
Really a symptom comes first.
Like a headache or high blood pressure or pain, of the joints or...
Yeah, anything. Here's the deal. I don't care if it's sore, stiff joints, if it's diabetes, if it's heart disease, even if it's cancer. We're going to talk about that when we have we're going to have a guest speaker in June come on who's a dear friend of mine, a doctor friend of mine who actually cured himself. They had metastatic bone cancer that went to his brain. He said they said it was incurable. Well, he's cured himself, and he wrote a book about it, and this is a best-selling book now.
Now, can you say that, though? Because you can't use the words cure and cancer in the same sentence together, can you?
Well, who says that?
I'm going to let him say it. 'Cause here's my disclaimer, though. All sickness, all disease, all symptoms and everything, it's all caused by something. So when people come into our clinics, I am not concerned with your headaches. I'm not concerned with your high blood pressure or your heart disease. I'm concerned about what the cause of that is. And if we can find the cause, if it's a chemical imbalance, maybe we need to change your diet, get the proper nutrition into you, detoxify your body. That helps with that problem. I've seen that happen with every symptom under the sun. You want to see, maybe there's a physical stressor. Maybe you have a misalignment of the vertebra in the spine, which we're going to talk a ton about today, which is probably 80% of most people's symptoms. So I want to encourage you all to tune into this because we're going to talk about some neurology today. You fix that physical stress. Look, I've seen blood pressure go down 15, 20 points with one simple chiropractic adjustment and stay that way for months to years.
And you're talking, like right now, you're talking about blood pressure and things like that. But I mean, you were telling me about a story, on the way to the studio about a kid who had like autism or, one of the, like an ADHD type thing. Right. And it's even affecting, you guys can affect that.
Well, let me just tell you this. We treat a tremendous amount of kids in our facility for all kinds of things. And ADD, ADHD, and autism are one of them. The story that you're referring to was a young boy who started care in our office about a month ago, and the young boy had extreme autistic outbursts where he would go violent. He would constantly have tics, or he would just constantly be yelling, and squealing and screaming because he's got sensory overload, which means when he walks into a room, could you imagine walking into a restaurant and hearing absolutely every conversation, hearing every TV, every radio? So the kid would literally cover his ears and he would shake and he would make noises because when he makes those noises, it blocks out the input. Does that make sense? Yeah. So he's got this sensory input issue. And what we did, we ran some functional neurological testing, found out that part of his brain was going too fast, which I love how Dr. Troy said last week on the program. I'm going to steal this. These kids with ADD, ADHD, and autism, they have Ferrari brains,
right?
But they have brakes like a bicycle.
Yeah.
And the problem is between the front of their head and the back of their head. And so we started doing some specific neurological adjusting to his spine. And within 1 month, you should see the change on this kid's neurological testing. But not only that, after the first 2 weeks, the kid's parents came in and were so excited because all the teachers asked, so has he been on new medication? What's different? Because he's not being violent, he's not spitting, he's not hurting. And then what we also notice now is when he goes into any room, instead of him covering his ears and shaking and just constantly making those outbursts of noises, he looks you in the eyes and says, hello.
Yeah, that's
Hello.
awesome.
And his parents are just like ecstatic about it. They've tried everything under the sun. But so all I'm saying is how we help that boy is just how we help with any other symptom. Find the cause, find the imbalance, correct the imbalance, and the problems go away. Does that make sense?
Yeah.
This is not difficult at all. And I don't care what
you guys
the symptoms
make it look a little easy.
Well, the number one thing that people always say once they understand this principle is, well, that just makes sense, and why hasn't anybody ever explained that to me before?
Well, the body's its own healer. If you allow it to do its job, then that's what's going to end up happening.
And again, we're going to get into that today because you're absolutely right. It's self-healing and self-regulating. I don't care what it is. I don't care the symptom. It can be fixed.
Yeah.
You understand what I'm saying?
I mean, but somebody's sitting there with like they've got a disc issue in their back or something like that. I mean, now that's an actual physical,
Right.
limitation. That's still something that can be fixed just through your body healing?
I've seen it happen time and time again. If you find the cause of the problem and fix it and keep it fixed, we were talking about this just a little bit ago. We were talking about nerve regeneration. We had a guy, we were talking about his nerves. He was paralyzed. And how come he can walk now when he was paralyzed? Well, and how come it took him a year and a half to get his leg function back? It's because nerves can regenerate and regrow. And forever, doctors didn't know this. We didn't teach on this. We know that a nerve can actually regenerate. I think it's 2 millimeters a day is the average. So about every 6 weeks, it can regenerate about an inch. So that's why it takes, if you're 6 foot tall and you can't feel your legs, it takes you years to get the function back to your brain. It can regenerate. If you understand how the body works and how neurology works, this is really simple. And that really gets me into the nut and bolts of what we're going to be talking about today. We have a guest speaker who's going to be joining us after the break. His name's Dr. Ankur, and he is a phenomenal wellness doctor out of Manhattan.
And you can follow all this that we're talking about today on Facebook, too. It's Nepute, Nepute Wellness, so Nepute Wellness on Facebook. Jump on there, and you can, track this with us.
Yeah. So stay tuned. We're going to be right back with more Wellness Matters.
Wellness Matters with Dr. Eric Nepute. Talk lines are open now at 314-969-9797 or 866-455-9797. This is Wellness Matters with Dr. Eric Nepute.
Welcome back to Wellness Matters. We have been talking to you all this afternoon so far about health, wellness, and symptoms. And we just, before the break, talked about how every symptom can be basically every symptom is caused by something. So if you are just taking a pill or having a surgery to fix a symptom like a headache or heartburn, indigestion, or chronic pain, you're missing the boat. And we want to teach you today how to fix that. And I mentioned before that stress is the number one cause of all these symptoms.
Right.
Any symptom.
I mean, so, Kane, weren't you talking the other day on your radio show about, were you talking about TMJ?
Yeah, TMJ. We had a gentleman on our show. Maybe we shouldn't mention any names, but his initials are John Pertzborn from Fox 2. TMJ is what apparently he suffers from. He was moving his jaw, and you could hear a little click. And I'm not sure how to even pronounce what TMJ stands for, but he, they wanted him to wear a mouthpiece and the whole nine, and it just causes other problems. Yeah. So what would you, as a chiropractor, with someone who has TMJ, what would you recommend?
Well, TMJ is right up a chiropractor's standpoint. It's a joint problem.
Right.
The temporomandibular joint, when there's dysfunction, it can be dysfunction from many things.
Easy for you to say. It's the what?
The temporal mandibular joint dysfunction.
Okay.
If you're ever on Jeopardy, or TMJ for short. I love when people come in and they go, I've got TMJ. We all have TMJ. We have two of them, temporomandibular joints, one here and one here. So the thing is,
that's a great point.
It is. What caused it? You know, there's an imbalance in the nerves that control the muscles around the jaw, and you fix those nerves, they tighten the muscles, it's fixed. Now, just like a disc can compress in your back and can cause back pain,
right?
The disc in your jaw, there's actually a disc in there, and you set that joint and strengthen the muscles, and it's fixed. So it can totally be treated.
You're serious.
I'm dead serious.
So what? We'll just have John Perchmore come on by the office, or what?
John, if you're listening, brother, you call the office at 314-544-5600. We'll give you no discount, and you come in, and we'll find it. Well, no, seriously, just like any symptom, you know, we'll help you find the cause of it and fix it.
Your jaws don't have to click anymore.
So hey, let's get into some, because we're running out of time already, and we've got so much to talk about. Listen, let me set this up real quick. I've got a doctor right now who's calling in from Manhattan, New York. He runs one of the largest wellness centers in Manhattan, and we're talking about stress is the number one cause of all sickness, disease, and symptom that's on the planet. I mean, have you guys both been to New York before?
Yeah.
I mean, there's just, could you imagine all the stress that's
there?
Oh my gosh.
I was stressed just showing up.
I can't imagine where there's no stress.
The only place you'll find people who don't have stress are buried in your local cemetery, and that's the truth.
Right.
So everyone needs good stress management, which is nutrition, chiropractic care, exercise, all these things. And we have Dr. Ankur Prakash on the phone with us right now, calling from Manhattan, New York. And I'm going to tell you, this guy, he's a genius. He's got one of the most phenomenal practices out there on the East Coast. So those of you that are on the East Coast listening, you need to look this guy up. He will help you change your life. So Dr. Ankur, are you there with us today?
I'm here, Dr. Eric, and it's a pleasure listening to you last about 10 minutes. It was awesome.
Man, let me thank you for taking time out of your busy Sunday and away from your family just to get on the airwaves with us a little bit and share what we're going to share with the people today.
Yeah, no problem. And can I just chime in real quick on what you guys were talking about?
Please.
I have never said that I am a doctor of chiropractic. We have that DC degree at the end of our name. We are a doctor of cause.
That's beautiful.
That's what we really are.
I love that.
I wanted to chime that in.
I'm going to steal that. Is that TM? I'm going to take. No, he's right, because that's what we do. That's why it blows my mind. And Dr. P, I know that you hear this every day. That when people come into your clinic with whatever symptom they may have, and when they're pointing at, let's say, example, they're pointing at their TMJ, like we were just talking about, and they say, I have this jaw problem, you may be looking at them from a nutritional standpoint or a stress standpoint or a nerve standpoint or whatever, and they say, well, no one's ever looked at me like this before.
You got it.
Because no one's ever found the cause. You
got it. And when you look at people that way, Dr. Eric, it's not that you're the doctor of the cause. You've now taken it another step forward, and now you're the doctor of the cause of the cause. And let that marinate just for a second, because you and I both know that the cause of most illnesses is dis-ease in the body. And we look at the spine, we look at the nervous system. You've mentioned subluxations on your radio shows in the past,
right.
But now we're addressing the cause of the subluxations in our practice.
And that's a beautiful thing, and that's so true. Really, Dr. Ankur, the big thing that I want to do is get that across to folks. So let me ask you a question, and I want you just to elaborate on this and see if you can explain it. You talked about the cause is the stress, the cause is the disease, the cause. Explain that a little bit more, and then how do we find that in people, and then how do we fix it?
Sure. And I don't even need to, it's not my word that people need to take. For example, the National Institute of Health, they basically said that 90% of all illness now is caused by stress.
Wow.
That's right.
And you guys were talking about it. Like, imagine being in New York. You're a fast-paced, high-tech, nonstop stress city. So in my practice, when people come into me and they've got XYZ complaints and symptoms, I look at them face to face. I put all the paperwork aside. I said, look, here's how my center could be a perfect opportunity for you. It's to not reduce stress. You're not going to be able to do it. Just like you said, you got to go into a cemetery to do that.
Right.
In my line, you got to get burned. But what we do is we improve your ability to handle, process, and adapt to stress. That is really the main secret of what I consider real healthcare, is teaching people how to adapt to stress better so that it doesn't kill them early on in life.
So we know, we've already established that stress is the number one, the body's inability to handle stress is the cause of all sickness, disease, and ultimately death. I mean, we all agree that, okay? Mm-hmm. So how do we find out what stress is that person's problem?
Cool.
So tell me about that.
So now that they've agreed to that, then we continue. So in our practice, once we've gotten that aha moment to click about stress, then we focus on, in our office, our examination. Probably going to be a couple of similarities to yours. We're looking at how stress accumulates first on their spine and nerve system, right? Because we know that the spine and nerve system is the master control system of the body. Everything needs a healthy nerve flow.
Right.
We look at stress there, and then we've got all these different technologies in our practice that will measure physical stresses on the body, right? That could be a distribution of weight on the hips, knees, and feet. It could be a poor posture, flexibility issues, even looking at body composition and how much, of their weight is muscle and fat. That's super important in terms of physical stresses. Then we go into nutritional stresses, right? We look at cellular health assessment, how well they absorb nutrients, how much inflammation that they have in their body, right? I'm sure you'll have a speaker that talks a lot about inflammation.
Sure.
In this country, how much water they absorb, their omega-3 intake, their food stressors, and then finally we use this great technology called heart rate variability, which kind of just, it gauges their emotional health, like how well they adapt to stress internally.
Wow. That's a lot of, that's crazy.
Well, that's great. I mean, that's exact, guys. Dr. Ankur, let me just say this to the listeners that are out there right now. That is what separates the doctors of the cause, finding the cause from everyone else.
Yeah, because, I didn't hear CT scan in that. I didn't hear MRI. I didn't hear,
Well, it's not that there's not necessary times for that, Ryan, but, you were talking to me earlier about how you saw a study that showed that CT scans actually, there's actually more risk than benefit.
It's so overprescribed.
Right. And take your TMJ guy, for example, you were talking about.
Yeah.
That person comes to my office and their sole purpose is to address their TMJ. They're still going to get their feet evaluated. They're still going to get their water absorption and nutrition, because all of that could contribute to something that could contribute to something that contributed to his TMJ.
Absolutely. And that's the thing, too. You're absolutely right. So if you just came in the office, and again, I know we're talking about TMJ, but it could be indigestion, it could be a colicky baby, headaches, migraines, whatever. And if all you do is focus on, okay, you have some type of a stressor that's causing the symptom, let's go ahead and cover up that symptom. That symptom is your body telling you that there's a big problem. And that may be heart disease down the road, or that could be a contributor to cancer or diabetes or whatever. And if you don't take care of it now, when it's a mild symptom, it is going to kill you.
Right. And addressing the symptom itself is really very reductionist.
It is.
It's really reductionist. You got to look at the big picture.
And that really brings me to another topic is people are really searching for the cause now. Now more than ever. I think there's more of a consciousness now for it.
For sure.
Ever. And it used to be years ago when I would have patients come in the office and Dr. P, they would say that, I've been to 15 different neurologists. I've been to, nutritionalists. I've even been to other chiropractors. I just got back from the Mayo Clinic and nobody can help me find the cause of my whatever symptom it is. And we run our scans, we do our nutrition check, we do this, and we find out that the problem that they're having, let's say they're having a shoulder pain, or let's say headaches, because that's really common that we see. Let's say that, they've had literally millions of tests done to their brain and their neck, and no one has found anything wrong. We take an x-ray, and we find out that they have a reverse of the cervical curve, and they've got subluxation, which, Ankur, the number one analogy I give with that is it's like a fuse box at home.
Yep.
It's like your fuse is blown.
Perfect.
We turn the fuse back on, and they get sometimes symptom reduction on the spot, which is not fixing the problem, because the problem is the reverse of the curvature that we have to fix over months to years. But we give them relief of their symptoms, and everyone always says, why didn't my other doctors do that?
Yeah.
Right.
I was going to ask Dr. Ankur, why do you think it's always, we were talking last week about, really chiropractic should be the first portal of entry. It should be the first place people look. Why do you think it's always almost the last?
It's probably a combination of just the poor social stigma that we have. I mean, we've been stamped as neck and back pain doctors, since the early 70s, since insurance dependency came on. And for 40 years now, we've been looked at as really, hey, you go to a chiropractor as your last resort for neck and back pain. And now all these studies, like even, for example, the Spine Journal in December of last year, just a few months ago, said that if you went to a chiropractor first, you have a 2,800% less of a chance a risk of having a lower back surgery.
Wow.
Isn't that
and I don't want to ever pigeonhole our profession into back pain, but can you imagine if they did that for diabetes or for heart disease or what you mentioned earlier about high blood pressure and checking the C1, subluxation?
Dr. P, what you're hitting on is exactly what we need our listeners to hear. In fact, our phone lines are lighting up already. We have got to take a quick, short break, but when we come back, Dr. Ankur is going to come talk a little bit more about his center in New York, and we're going to talk more about this. So stay tuned to Wellness Matters.
Wellness Matters with Dr. Eric Nepute. Talk lines are open now at 314-969-9797 or 866-455-9797. This is Wellness Matters with Dr. Eric Nepute.
Welcome back to Wellness Matters. I'm your host, Dr. Eric Nepute, and we have been talking about symptoms, health, and sick care. And we've just got done talking about how all your symptoms are caused by something. And we've got Dr. Ankur, who is from Manhattan, New York, and we've just really been, rocking this first half hour out. And I want to mention, because we've got a lot of people on Facebook that are asking questions, and we're going to take some calls in a minute with Dr. P. But I also want to I want to let people know, Ryan, where can they find us on the web?
Yeah, just kind of follow all this. It's Nepute, Nepute Wellness, so Nepute Wellness on Facebook.
Right. And then, Dr. Prakash, where can we find you at? Where can our listeners find you?
Sure. Our website is wellbalancedchiropractic.com, and then the Facebook page is facebook.com/wellbalancedchiro.
Perfect. Cool.
And make sure that we tag his stuff.
Yeah,
on
we definitely will.
We've got so many patients that call us from all over, really the world, especially all over the United States, but they want to find doctors who the work that we do. What I want to do, Dr. P, is I've got a couple callers that are trying to call in to get some of their questions answered. Let's you and I answer one or two of those together, and then we'll go from there. So let's go ahead and take line one. Barb, welcome to Wellness Matters. What's your question?
Hello. Yes, I have a question about some nerve pain. My doctor said it's a nerve that comes over the hip onto the top of the thigh. It's a little bit to the right and the left on each thigh. It's just the very top. Mm-hmm. And it's a big long name. It starts with M, I believe, and it's horribly painful. Okay. It's like stabbing electric pains, but it's very specific.
Okay.
It's in that very specific thigh area. It's not my knee. It's not the back. It's not the inside thigh.
Sure.
Is there any relief for that? Because I went to a neurologist, and he said he couldn't help me.
Well, he's probably right. He probably can help you. That means you need to find another doctor that can help you. So, Barb, here's the deal. What did the doctor say the cause of the problem was?
Well, about 5 years ago, I fell in my shower, and I cracked 3 ribs.
All right.
The ribs healed fine, but after that, I began experiencing this pain in my thigh.
Sure.
But it went away. It kind of went away, and it'd come back if I only walked long periods of time or stood a lot, like in a line of something.
Totally understand.
Just recently, in the last couple of weeks, it's come back with a vengeance.
All right.
And I'm just like crippled, and I wake up in the night. I can't do anything. It's terrible.
So, Barb, here's what I want to do. First of all, I appreciate your call. There's absolutely hope for you. We have to find the cause of the problem. So I want you to hang up. I want you to listen, because I'm going to answer this call, answer your question. I'm going to have Dr. Ankur chime in as well. So, Barb, listen, here's the deal. When you had that fall, now I haven't examined you, I haven't looked at you, I haven't looked at your x-rays or your nerve test or anything like that. But when you had that injury, and I want everyone to listen who's dealing with pain or any other problem, when she had that injury, that could have been a physical trauma that happened to her spine years ago, she said. She had the pain for a while. Then the amazing thing about her body was, so remember, that fall was the stress that initiated the pain. Her body adapted to that initial stress for a while, and then she had no pain. Well, she just mentioned, Barb, you mentioned that the pain came back with a vengeance just the past couple weeks or days ago. So guess what's happening? Your body's not adapting to that pain anymore, or to that stress, you see? So we have to find the initial cause of that and correct it. And I've seen thousands, tens of thousands of people that have had the same problem. We've been able to help almost every one of them once we find the cause. Now, the cause could be physical, caused because she had a fall and it compressed her spine, caused a subluxation, which is could be a misaligned vertebra that's irritating that nerve. Something's making that nerve mad. She could also be deficient in certain minerals and nutrients and be pro-inflamed. She could also even have an emotional stress because she fell in the shower and now she's scared of what's going to happen to her health. You see, there's lots of things. So, Barb, here's the thing. I can't tell you how many people that I've seen that have gone to different neurologists, the Mayo Clinic, the quote-unquote best doctors in the world at what they do. But you have to understand, if you don't fit in their box, they don't know what to do with you, and you don't fit in their box. So you need to find a new doctor who's got different type of boxes, actually who doesn't have box, who looks outside the box, and helps find the cause of it. Does that make sense to you guys?
Yeah.
Yeah, I think you got it all.
Yeah, I mean, Dr. Ankur, is there anything else that you would add to that?
No, just Barbara, look like assessing your spine, looking at how healthy the nerves are in that lower back, even in the mid back and neck, looking at your flexibility, your muscle tone, and like you said, also looking at chemical stresses. Definitely, you want to look at inflammation.
Yeah, absolutely. So well said. Dr. Ankur, I want to ask you this. I always like to ask doctors all over the world that do amazing miracles in their practice every day. I want to hear some of the miracles that happen in your practice that you think is cool. So share this with our listeners because our people want to know. Tell me about it.
Oh, I could totally do that. In fact, I'll just give you some recent ones.
Please.
I'll give you a recent one. So we had I do quarterly progress reviews with every member of our practice. So by practice members, I'm very big on words, so I don't call them patients. We call them members of our practice. So I'll call her name. Her name's Chrissy, and she came in originally 3.5 months ago with neck and back issues, but on a subjective level, huge relief in that area, improved her posture and flexibility. But here's the thing, which I love what we do, is that on her progress review, and this was just this Friday evening, she told me that she's getting less angry and she's less agitated. Wow. And the best thing that she has seen is that she no longer gets pissed at her husband.
That's
way
awesome.
better response to stress. And then, of course, we still did all the cellular analysis. We looked at how much better she's absorbing nutrients. Omega-3 levels went up, and she's even lost 2% body fat in 3 months.
So what I heard there was this, is that you had a lady who came in who thought she needed some help with some pain, but you did your assessments, your testing, and found out she was imbalanced in multiple areas of her life. You started treating those areas of her life, and not only did her pain go away, but her life improved.
I got a better one.
Let's hear it.
There's someone better.
Yeah.
So 9 medications. He's off of 7.
Okay.
He's no longer HIV and AIDS detected. He's now off of high blood pressure meds. He's off of most of his diabetes meds. He's lost about 25 pounds doing both chiropractic, personal training, and massage in our practice.
Man, that's awesome.
How about that?
That's amazing. Before we move on to the next one, because you said something that I saw eyebrows go up like crazy in here. You said this guy is off multiple medications. He is no longer HIV or AIDS detected.
That's where the eyebrows
now, listen,
raised.
Here's one thing I want to say is this, and then I want, Dr. P, I want you to illustrate this if deeper if you want. So when we start getting a balance back in the human body, the nervous system starts to work better, which controls everything, okay? Now, when the nervous system works better, the immune system works better. So if we get the immune system boosted, guess what happens? We don't have sickness, disease, infection, HIV, AIDS, all this kind of stuff. The detection of it goes down. Dr. P, is that correct?
You got it, yeah.
I mean, that's a bold statement.
It's the truth.
Look at the research, it says I think it's with chiropractic adjustment, it improves the immune function by 270%, something like that, about 200%.
I've seen on the research show 200 to 400%, depending upon which one you look at.
Yes, you got it. And the key is that I never once looked at this woman and said, hey, we can help you with anger, or this guy and said, hey, we can help you with HIV and AIDS. I looked at them and say, hey, we can help you, period. And that's the same thing I would say to Barbara, too, is that you want to get a doctor that doesn't just look at the leg and the pain in the thigh. It's about looking at Barbara.
That's right. That's right, Barbara. And depending upon what part of the world you're in, if you're not in the Midwest and accessible to us in the St. Louis area, if you're on, call us. We'll help you find someone who can help you. Our clinic is 314-544-5600, or look at us on Facebook. We'll help you find doctors that know what they're doing.
Yeah, I actually enjoy doing that. I don't know, Dr. Eric, if you ever interview, I always find doctors for other practice members, family, and friends throughout the country.
And especially if they travel or things like that.
Oh, yeah, all the time, and I have great sets of interview questions.
One thing that I do also want to bring up is this. Do you guys remember Of course, everybody remembers. You remember Magic Johnson?
Yeah, I was just going to bring that up about that.
So you remember, I don't know, it was in the early 90s, I guess, when Magic Johnson was actually, came out and said, he's HIV positive, but doesn't have full-blown AIDS. And do you remember there was all this talk that Magic Johnson was going to a place, I believe it was Arizona or New Mexico or somewhere, and he was getting a special type of a cocktail made for him.
Yeah.
Oh, that's right.
You know what that cocktail is called? That's called a Myers cocktail.
Well, that's what you guys have in your office.
That's exactly right.
Wow.
So listen, what that is this. What it is, it's a mega dose. It's an IV vitamin infusion that's prescribed by our medical team, and we give high doses. So Dr. Ankur, we give you can do anywhere between 60 to 160 grams of vitamin C right into a vein. Mm-hmm. Could you imagine, the antioxidant properties of vitamin C and B vitamins? So anyway, so all I'm saying is that, medicine has this, it's almost like the Wizard of Oz behind this big curtain. Everybody's so fear-based and is scared not to do what they're told to do by their standards of care that they don't look for alternative solutions. And it sickens and appalls me. So anyway, I don't want to get off on a tangent on that. But Dr. Ankur, any more cool stories that you want to share with us?
No. Let's see. Yesterday, I went over a guy's second progress review, and here's another story. He comes in. He's a computer programmer, so sitting all day. He's got lots of stiffness in his neck and upper body, but his 3 biggest responses to care, and he's been under regular chiropractic care, regular personal training, and regular massage in our office, is that he has less anxiety and he sleeps better, and again, he's also has dropped a couple of percentage body fat.
That's great.
And it's so funny, there's no workout that's specific to just improving or reducing anxiety. There's no specific adjustment that I can give to help him hang out with his wife better and not get so angry. It's just ultimately it's improving this guy's health inside out.
Yeah. This is what you're saying is so great. We're talking about how stress is the cause of every symptom that's out there. And when we talk about stress, we don't just mean the emotional stress like anxiety and insomnia and depression and all that stress. We're talking about chemical, physical, and emotional stresses. So, it's finding that imbalance is there. And this is what I want all of our listeners to think is this: start thinking differently. The quality of your health is in direct proportion to the quality of the questions you ask yourself and ask others. So if you have a problem, ask yourself why. Why do I have this sickness? Why do I feel this way? Why do I have this symptom? And then when you go to a doctor, and you should interview that doctor, when the doctor finally does their testing and says, you have this problem, ask them why. Why do I have this? Okay, and then here's my treatment for it. Why is that treatment good for me, and how is it going to benefit me, and what are my side effects?
Yeah.
You see, that's the thing that we need to start rethinking, because the number one problem we have in our sick care system is that it's sick care, not health care, and we don't ask quality questions.
Yep, you got it. It's a great interview question. Great interview about asking for side effects and really understanding the difference between health care and sick care.
Yeah.
I come from a large family of medical doctors. I've got lots of cousins, a couple uncles and aunts, and it's not that I'm anti-medicine or anti-surgery. It's just that I'm pro-health. And medicine, there is a absolute time and place for it. I've been in a problem where I've had required that, but it wasn't addressing the cause. It was masking a symptom, which I needed help at that time. That's it. I did everything else in my power to get that stuff out of my body.
Dr. P, when we come back from this break, you're totally stealing my wind, because, brother, that's what I want to talk about on this next segment is sick care versus health care. Awesome. So I want all of you to stay tuned. The last segment we've got, go ahead and keep calling in. The lines are open. Facebook, Nepute Wellness.
Yep, Nepute, Nepute Wellness, or you can call in 866-455-9797.
Right. So stay tuned. We'll be right back.
Wellness Matters with Dr. Eric Nepute. Talk lines are open now at 314-969-9797 or 866-455-9797. This is Wellness Matters with Dr. Eric Nepute.
All right, welcome back to Wellness Matters. I'm your host, Dr. Eric Nepute, and we have been speaking with Dr. Ankur Prakash from Manhattan, New York, about how to cure all problems. We were talking about how stress is the number one cause of all sickness, disease, and death, and if you find the cause of it, you'll get rid of your symptoms. So what I want to do, Dr. P, on this last segment, we're going to take a couple callers, and you and I can help answer these folks together, if that's all right with you. So let's go ahead and go ahead and give me line 3. Jeff, welcome to Wellness Matters. What can we do for you?
I'm 53.
Okay.
A lot of my family had heart disease, stuff like that. Last summer was in the hospital. I thought I was having a heart attack, and they did all the stress tests, and my doctor said that, my family may have heart disease, but I don't.
Right.
But I still have high cholesterol.
Okay.
And what I'm wondering, and my doctor has prescribed me to be on a statin drug.
Right.
And recently I've read all kinds of stuff, and I have restless leg syndrome and all that kind of thing. And it's one of those things that's possible in that long list of stuff. And I was wondering, would you take a statin drug for any reason?
Me personally?
Yeah.
I personally would not. Now, I have some patients that we still have them on a statin. But usually they're folks that we've gotten them from taking 5 or 6 statins a day to maybe 1 because they've got serious damage to their body. And Jeff, let me tell you this as well. What I would do is find out, why do you have high cholesterol? Is it dietary? Is it nutritional? Is there an emotional stress? Is there a hormone imbalance? I just did a whole workshop on this, and contact my office and we'll give you the workshop, or come in and we'll help you find the cause. Jeff, I would also look and see, I've actually got in front of me, and I know Dr. Ankur knows about this, I've got the Windsor autopsy studies that actually said, Jeff, this is a medical doctor who did a study to disprove the efficacy of chiropractic, and they found out that the nerves that control the heart, whenever they were damaged or subluxated, correlated to 100% of heart disease. Which means if there's a nerve in your back that's not working like it's supposed to, it can cause your heart issues. Does that make sense? And I have family members that are in medicine and that are in cardiology, and we share that with them, and it really blows their mind.
Yeah, same here. It's looking at heart disease by not just the cardiovascular side,
right,
but also the electrical side.
Yeah, that's absolutely right.
Yep. And heart rate variability is a great test for that. And also, Jeff, looking at omega-3 intake, because I have practice members of mine that always ask me about statins and any family members who've been on it, and usually I really look at how much of their omega-3 intake, and there's a great permeability test you can do from a company it's a BIA machine, and it really helps look at the omega-3 intake of the body. And for people, and all the studies that I've read show that statins may reduce your cholesterol, but it's the omega-3s that not only reduce your cholesterol, but reduce the plaque that builds up in the inflammation in the arteries. And
Dr. P, just to add to that, and I think we've given Jeff a ton of info, I hope, is that there's also no research that shows that the statin drugs actually decrease the risk of heart disease. They may lower your cholesterol, but they're not going to reduce the risk of your heart disease. So, Jeff, I hope that answers your questions, or at least get you started to your new journey. So, if you have more questions, hang on afterwards, call the clinic, call us. We'd be happy to help you.
Okay, and I guess on here you'll be able to tell me how to get hold.
Yeah, 314-544-5600. Call us, and we'll figure out where to get you going. Or you can go on our Facebook page.
Are you in Afton?
Yes. Yeah.
So is my office. So,
well, perfect. We'll come on by, set up a time, and I'll help you.
Great. Sounds good. Thank you.
Let's go ahead and go to let's go to listener number 1. Go to line 1. David, welcome to Wellness Matters.
Yeah, so my daughter, she's 15. She was diagnosed August 16th of 2012 with chronic myeloid leukemia.
Right.
And, I tried everything I could to see if there was some way of approaching it differently.
Right.
Every doctor in the world has basically come back to me and said that there's no option for her other than a bone marrow transplant, which we're at the hospital now going through that awful process of chemo and everything. And I just wanted to get your viewpoints, because earlier in the segment you mentioned that there are some things where traditional medicine is good for. Is this one of those cases?
Well, David, let me first say this. I can feel the pain in your voice, and I can hear it. I mean, this is something that when your child is ill, you're going to – and I love that you're kicking over every stone that's there. I would encourage a couple things. Number one is this, especially when it comes to cancer, leukemia, and things like that, you've got to boost this girl's immune system. We've got to find out where the dysfunction is. Now, emergency medicine, things like chemo and radiation, there is a place and a time for this once you've exhausted every outlet. Now, I want to give you a reference that I want you to look into. There's a clinic in Houston, Texas called the Brzezinski Institute. Have you heard of this, David?
Yeah, once or twice I think I've heard of it.
So here's the thing. You need to get a hold of these people. These are the leading experts in treating this type of cancer.
Right.
Call
nutrition. They do a lot of nutritional work.
They do the injections. They do the chiropractic. They do everything. They have a whole team that actually they are the best on the planet. I'm going to tell you, if I was with a diagnosis like this, it was my little girl, the first place I would turn is to them. The second place I would turn is to a wellness doctor. That's my advice. Now, we're also going to keep working with the medical team, with the oncologists and everyone. We're going to work collectively to make sure that this little girl, not only does she beat this flare-up that she's got now, but we're going to make sure it doesn't come back again. You see what I'm saying? Dr. Ankur, what are your thoughts on this?
No, I think you nailed it right on the dot, is really just look at it as, rather than treating the leukemia, just really look at how can we boost your daughter's immune system, that reaction in the inside out.
So, David, again, please, as soon as we're done talking, you're more than welcome to get a hold of me at my clinic anytime, or Dr. Ankur, or wherever in the world you're at. We'll hook you up with the right doctors there. But get online and look at the Brzezinski Institute, and they are they're in Houston, Texas. And I know that we've got someone this summer that's going to be on the show from that clinic talking about their trials, tribulations, and the success that they've had.
Well, yeah, most of the trials and tribulations for the Brzezinski Institute came from the FDA.
Yeah. Well, they've been sued by the FDA multiple times and beat them every time.
Yeah.
Because they were curing cancer.
Right. And the FDA was like, well, we can't have any of that.
Well, now they approved him so people can go see him after. Unfortunately, but a lot of times it's after you've failed other chemo. So, David, listen, I pray for you. I pray for your daughter.
Yeah, for sure.
And please get a hold of me off air, and I'll talk more about this with you. I can assure you there are more things to do than you're doing right now, and I'd be more than happy to help guide you towards that. Okay?
Okay, thank you.
All right, my friend. So, listen, Dr. Ankur, we've got about 2 minutes left of this program. So I know that I told you this goes fast.
Yes, it is. You're right.
I just want to thank you for your time and your commitment. And I want to invite you again to come on the program. And I want to encourage all of our listeners that are on the East Coast to get a hold of Dr. Ankur.
Yeah.
And you can find him again.
I'll put a link up on our Facebook page on Nepute, Nepute Wellness on the Facebook page. I'll put a link up to where you guys can, if you're on the East Coast, you can get a hold of Dr. Ankur.
Yeah. So Doc, I appreciate your time. We'll be talking soon again. I just want to say to you out there in Radio Land that, listen, we love the support. Keep the questions coming. We are here to help elevate your life and help take you to the next level. So have a great rest of the weekend and a great next week. And tune in next week at 3 p.m. because remember, wellness matters.
Awesome.